Please review this video for instructions regarding your pet's care in the postoperative period. When you arrive at the hospital to pick your pet up from surgery, a technician can address any questions that you may have regarding these instructions. Your discharge technician will also discuss any medications that your pet needs to take and when and how to administer them. Your pet will be sent home with several medications following their surgery. Please complete all medication courses as directed on your pet's discharge instructions. Do not stop any medications without consulting a member of Dr. Snickard's team. If you are concerned your pet may be experiencing side effects of a particular medication, please call to discuss with a member of Dr. Snickard's team. Orthopedic surgeries create pain and inflammation. The pain medications that have been prescribed are important to help manage not only your pet's discomfort, but to reduce inflammation at the surgery site. Pain charts can be useful in determining if your pet is painful, but pets can also be good at hiding their pain. Therefore, your pet's pain medications must be continued for at least 2 to 3 weeks following surgery, unless otherwise directed on your pet's discharge instructions. We will now discuss how to use one of these two pain scales to determine if your pet is painful following their surgery. For cats, their ears will be facing forward, eyes opened, muzzle relaxed, whiskers will look loose and curved, and their head will be above the shoulder line if they're comfortable and feeling good. For cats that are starting to get painful, their ears will be slightly pulled apart, eyes partially opened, their muzzle may be mildly tense, their whiskers might be slightly curved or straight, and their head will start to droop and be aligned down with their shoulder line. For cats that are more painful, their ears will typically be flattened and rotated outwards, their eyes will be squinted, their muzzle will be tense, their whiskers will be straight and moving forward, and their head will be bowed down a little bit below the shoulder line or tilted down. Other signs of pain in cats can include hiding behaviors or refusal to eat. To determine if your dog is painful, you want to look at their body language. Your dog should be comfortable when resting, look happy and content, and not bothering their surgical site. If your dog is becoming painful, they may look unsettled, restless, they may appear uncomfortable when resting, they may groan, whimper, or cry, or lick the surgical site. Their ears may start to droop, or they may develop a worried facial expression. They can also develop reluctance to respond or move when you beckon them, and they're less eager to interact with you. Another good way to determine if your pet is painful for either a cat or a dog is to pet them along their back and then gradually work your hand down towards their incision and gently touch the area. And if your pet flinches away, whimpers, or cries, that might be an indication that they're feeling some pain at the surgical site. If you feel that your pet is not well managed by the pain medication that we've provided following their surgery, please reach out to us and we'll develop a plan to keep your pet comfortable. Please do not administer anything over the counter to your pet as far as pain medications go. Human pain medications can be quite toxic to pets. Please feed your pet half of their normal dinner after 6 p.m. tonight. We recommend this smaller feeding the night following surgery to prevent any regurgitation or vomiting. Normal portion sizes may be resumed tomorrow morning. Please offer a small amount of water when you get home, and then make sure that they do have a bowl of water down later in the evening, and they should always have access to fresh water. If your pet's doctor is recommending any calorie adjustments following your pet's procedure, they will be outlined on your written discharge instructions. Constipation can be commonly seen following anesthesia. To prevent this from occurring in your pet, Miralax or plain canned pumpkin can be administered. Please choose to administer Miralax or pumpkin, not both unless otherwise directed. Please ensure that if you choose pumpkin, that it is the plain canned pumpkin, not the pumpkin pie filling. Please review your discharge instructions for your pet's dose, or review the following charts for dosing. The charts list a pet's weight in pounds on the leftmost column, and the dose for pumpkin or Miralax in the right column. This dose should be repeated twice daily. Please start one of these options if no bowel movement is observed within a day or so following surgery. If your pet displays vomiting, diarrhea, anorexia, or straining to defecate without producing a bowel movement, please call our hospital. Your pet will require 12 weeks of restricted activity. Do not allow running, jumping, or rough play, or any off-leash activity. Please have your pet walk in a slow, controlled manner. Offer support with a sling or help them up harness for at least 2 weeks, especially on slick surfaces such as tile, wood floors, or icy surfaces. Utilize yoga mats or throw rugs to help provide traction. Please limit your pet's activity to one room of the house with brief, controlled leash walks for elimination. Please confine your pet to a crate or a cage if your pet cannot be kept quiet on one level or one room. Please avoid retractable leashes during the surgery recovery. Please keep your pet on a short leash so their activity can be kept controlled. We want to avoid any pulling or darting on the leash. Do not allow your pet on furniture or beds, or allow free access to stairs for a minimum of 8 weeks. If stair use is necessary, it must be on a leash and slow and controlled. Please utilize baby gates or shut doors to rooms where there is furniture or stairs that your pet may want to access, or confine your pet to a crate or a cage. If your pet is a small size and they will have to jump to go up the stairs, it is recommended to carry your pet up the stairs instead. Do not leave your pet unattended or off-leash outside. Do not allow unsupervised interaction between pets. Dr. Snakard may allow for more indoor activity after the 8-week reevaluation. Failure to follow exercise restriction instructions can result in complications and additional financial cost, and can prolong the recovery time. If your pet is typically very active and you think you may have trouble adhering to these instructions, please let your doctor and surgical team know so we can develop a plan to ensure that you are successful. Cats have some additional considerations for activity restriction following orthopedic surgery. Just as previously discussed, your cat should be restricted from running, jumping, and rough play, and should not be allowed to access furniture, beds, or stairs. Keep your cat separated from other pets in the household. Please confine your cat to a smaller area. Your cat should be shut into one room where they can be restricted from jumping or climbing. Alternatively, a cage or large dog crate can be used instead and can house your cat's food, water, litter, and bedding. Please do not allow resting in the litter box. If you notice the litter sticking to your cat's incision, consider changing to a litter such as crystal litter, yesterday's news, or paper shredded litter. These litter types will be less likely to stick to your pet's incision or bandage. A large, low-sided litter box will be easier for your cat to access following orthopedic surgery. An old baking tray or cake pan can work well for this purpose. Please clean the litter daily and observe your pet's waste for any abnormalities. Failure to follow exercise restriction guidelines can result in surgical complications. If your pet is typically very active and you think you may have trouble adhering to these instructions, please let your doctor and surgical team know so we can develop a plan to ensure that you are successful. Please monitor your pet's incision twice daily for any abnormal signs. Bruising and swelling are commonly observed following orthopedic surgeries. Please look at your pet's incision when you arrive home from the hospital so you know what degree of swelling and bruising is already present. If you're noticing increases in redness, swelling, or bruising, please reach out to our hospital. A small amount of blood-tinged discharge can be observed the day of surgery. However, if you're noticing any other discharge, or if the discharge is continuing beyond the day of surgery, please reach out to our hospital. The swelling observed along the incision line will drop with gravity over a period of 1 to 3 days. This is expected and normal. We recommend taking a photo of your pet's incision shortly after arriving home from the hospital. This will allow you to more easily monitor for changes in your pet's incision. Utilizing a cold compress following your pet's procedure is recommended. This helps to manage pain and inflammation at the surgery site. Please use any soft ice pack that you would use on yourself and apply it to the incision with a barrier layer. This barrier layer can consist of a clean towel or clean washcloth or a stack of paper towels. This layer is important to prevent any bacteria or moisture from getting into the incision. Please utilize the cold compress 3 times daily for 10 minutes at a time for at least 3 to 4 days following your pet's procedure. Please also ice your pet's incision after all walks and rehabilitation exercises. This should be continued beyond the 4-day mark. If fur or litter begins to stick to your pet's surgery site, intermittent, slightly damp but not wet, warm compresses can be applied to the area to soften the material. Then, tease the material off the surgery site with a cotton swab. If you are not comfortable performing this procedure, or if you are concerned about the incision, please call our hospital. Please discourage your pet from licking, chewing, or scratching at the surgery site. Licking, chewing, or scratching of the surgical incision may result in trauma, dehiscence or opening up of the incision, or infection of the surgical site, prolonged healing or recovery period, or additional financial cost. A recovery wear item will be provided to avoid these complications and additional financial cost. The recovery wear must be worn at all times for 2 weeks or until your pet's suture or staple removal if applicable. There are 2 different options for e-collars. The first is a plastic e-collar, also known as a funnel or cone. It is clear, can be wiped clean, and broken down for storage. The second is the calmer cone, which is a softer fabric cone. It is held together by Velcro, which is important to note as the noise of the Velcro may startle your pet when putting the cone on or taking it off. This collar can be washed in the washing machine and air dried. Inflatable e-collars should not be used unless they have been discussed with and approved by your surgeon, as they are often not an effective method at preventing licking or chewing at the incision site. If an inflatable e-collar has been approved by your surgeon, then a lick sleeve must be worn in addition at all times. Please visit the website for lick sleeve to review the care instructions for the sleeve. At-home rehabilitation exercises should start immediately following surgery. They should be performed 3 times daily. These exercises are important to preserve the flexibility of the affected muscles and joint, to encourage normal range of motion, to decrease the formation of scar tissue, and to help the limb to return to normal function. Please review the following YouTube video to review the exercises that Dr. Snigard would like you to perform on your pet. As the weeks progress, we will be adding in additional exercises. Performing a massage of the affected area or applying a warm compress can help your pet to relax prior to starting the rehabilitation exercises. The warm compress can consist of a rice bag or a warm washcloth zipped into a Ziploc bag. Whichever method you choose, you should apply it to your own forearm to make sure that it is not too hot, and a barrier layer should be applied to your pet, such as a clean towel or clean paper towel, so that the warm compress is not directly on their skin. The warm compress can be left in place for 5 minutes. Your pet may develop soreness following the completion of the rehabilitation exercises, so it's important to follow up the exercises with a cold compress. Please ensure that you have a barrier layer between your pet's skin and the ice pack. The ice pack can be left in place for 5 to 10 minutes following the exercises. If you have an CC loop at home, you may use this device as directed by your veterinarian during the rehabilitation period. It is important to remember that you should wait at least 2 hours between each treatment with the CC loop to preserve the device's battery life. Part of your pet's rehabilitation therapy will consist of leash walks. Please start slow, controlled leash walks tomorrow. Do not use retractable leashes. Please use a short leash so that your pet may be controlled. We want to avoid lunging, darting, and pulling on the leash. For the first 2 weeks following surgery, please perform 2 very slow, controlled 10-minute leash walks per day. During this period, again, it is important to offer support to your dog via a sling or a help 'em up harness to avoid slipping during these walks. For weeks 3 and 4, please add in a third 10-minute, very slow, controlled walk. For the 5th and 6th weeks, please perform 2 15-minute walks per day total. For weeks 7 and 8, add a third 15-minute walk per day. For weeks 9 through 11, slowly increase the pace of the leash walks. For week 12, slowly return to normal outside off-leash activity. Start with 5 minutes of off-leash activity 2 to 3 times a day, then gradually increase the off-leash activity. There will be several follow-up appointments after your pet's surgery. The first will be suture or staple removal in 10 to 14 days. At that point, you may begin rehabilitation with a specialist. If you do think you will pursue rehabilitation with the specialist, it is recommended to book these appointments ahead of time, as they do tend to book out a few weeks. At the 4-week mark, you will see Dr. Snicker back for a progress report to assess how your pet is healing. The final recheck will be performed at 8 weeks. Radiographs will be performed at this appointment to assess your pet's healing. Sedation will be required to obtain these radiographs, so please do not feed your pet the morning of this appointment. Following your pet's surgery, there are some symptoms that we would like you to monitor for that we do not like to see in our recovering patients. These symptoms include vomiting or diarrhea, loss of appetite, refusal to drink water for more than 1 day, profound weakness or lethargy, no urine produced for 24 hours, pale or bluish gums, changes to breathing or difficulty breathing, or problems with the incision site. Please reach out to us if you notice any issues, or call a veterinary emergency center, such as Cornell or Veterinary Medical Center. Cornell's number is 607-253-3060. Veterinary Medical Center's phone number is 315-446-7933.